special treat today. May is Mental Health Month, and I asked one of our members of our community, who happens to be the senior director of Be Well Texas over at the University of Texas Health, and an assistant professor there, and asked Thara Wright to have a conversation with me about mental health. And so, Thara, come on up. Okay, good. That's good. Yeah, you need that, right? You need that. Thank you, Thara. Thank you.
Thanks for having me.
So we had a conversation last week, and we went all over the place. So if we get to about 30 minutes, somebody just tap us and say, "Hey, don't forget, we're here." Thara, thank you. Introduce yourself to the folks.
So it's nice to see you all. I see you all pretty much weekly, but my name's Thara Wright. There's my two little loud kiddos over there. You probably hear them from time to time. Actually, Gracie's in Children's Chapel, but I am a psychologist, a developmental psychologist, and I work at UT Health San Antonio. I've been there for about 10 years now, and I'm the senior director of our program called Be Well Texas. And we provide substance use disorder treatment across this entire state through a couple different initiatives, and one being a clinic that we run to serve basically anyone with insurance, without insurance, free services if needed, and things like that. So that's a little bit about me.
Good work, too. Good work.
Thank you.
I was reading as I was preparing for this time. I saw that last week the Surgeon General called isolation and loneliness a public health crisis. And in the note, he cited increases in heart disease, stroke, dementia in older persons, and the risk of premature death increased by 60%, which all of that was shocking. So, and we've all been hearing that mental health crises are getting more and more prevalent for people of all ages. Is what you're seeing in San Antonio consistent with the national trends?
Yeah, actually, the pandemic affected us all in one way or another, right? We weren't coming to church, we weren't going to the grocery store even to get, that type of superficial social interaction. We weren't going pretty much anywhere for a really long time. And so what we've seen across the country is rates of all kinds of mental health illnesses increasing, and San Antonio is no exception to that. In my field in particular, we've seen a huge increase in overdose deaths and overdoses in general, and we tie those all together with mental health. And so San Antonio has actually some of the highest rates in Texas for overdose rates and deaths. And what we've seen is that people, as a result of the pandemic, whether it be financial hardships or social hardships, or they've lost their job, whatever it may be, that there's a lot of people suffering. And even those of us that didn't have that effect, we were cut off from friends and family, and we didn't get to have those meetings or just any of that type of interaction. And while video and
Right.
Facebook can be great, it's not quite the same as
Right.
being together with people.
Right.
So yeah, San Antonio is no exception,
Right.
unfortunately.
So you mentioned Be Well Texas, and you provide resources for people who disease of addiction, and I'll say and mental illness, because I think those two are often addiction and mental illness kind of go hand in hand. And in my own experience in 12-step recovery, there's a lot of people who have the dual diagnosis. They've got an addiction and they've got some kind of a mental health issue, and they use alcohol, drugs, those addictive behaviors to sort of treat that underlying mental illness, and of course that doesn't work. That just makes things absolutely worse. It's you have depression and you're pouring alcohol on top. You're just pouring a depressant on your depression and just increasing it.
Doesn't work out well.
No, it doesn't work out really well. So talk to us a little bit about some healthy ways to cope. I mean, I know lots of people just, they get stressed out, they need to do something, they feel like they need to do something. What are some healthy ways for us to cope with our stresses and struggles?
Yeah, so healthy ways, I'd actually put it to you guys. What is a healthy way to cope? Exercise. Sleep. Go outside. Yeah, that's one of my favorites, actually. Anything else? Read, write. Those are all really great methods. I always talk about our world is so loud, right? No matter where we are, the world is loud. There's a lot happening. We're getting messages all the time. If you're on social media, you're seeing messages. The information coming from the news is very negative and full of fear. And so taking a break from that and however you see fit is really healthy. I'm a true crime addict, I'm not gonna lie. I love true crime, right? But is that necessarily a healthy coping mechanism? Probably not.
Just increase the fear, right?
It is a very dark coping mechanism, right? So I've found in the past few months, like I really enjoy watching comedies, actually. Who knew? So if we find ways to take us out of those moments of loudness and those moments of that negative cycle of information, it can be really helpful in whatever way that is for you. If you like being outside, you like going for a drive, you like reading for a few minutes or doing yoga or meditating or something like that, those are really healthy ways to cope. But I would be remiss if I didn't say that things like counseling and seeing a psychiatrist are also really good, healthy ways to cope. Right. And you don't need to wait until you're at the point where you are rock bottom and you can't get out of bed, you can't move, to see those people. I personally have seen a therapist for a long time, and I love my therapist, and sometimes I don't have a ton to talk to her about, but sometimes I do. So it really just depends. We've taken our daughter to play therapy because she was just struggling when she was 4 and 5 years old, right? And to me, that was more of a prevention technique than a necessarily like, oh wow, she really needs help technique. So those are things that you can do and it's not everyone has the insurance and not everyone has, there's a lot of barriers to getting help. It is a little easier nowadays because we have all these virtual therapies that are really helpful. So I'm more of a, like, I'd rather prevent that negative coping, and by engaging with people or engaging with a group that you really love. Sometimes that in and of itself is just a way of dealing, even if you don't necessarily realize it, you may be having these deeper conversations with people when you go out to lunch with your friends or you're meeting at church with people. Right. And it kind of helps to prevent that cycle of negativity and kind of getting down in the really dark, I like to call it the dark hole, kind of getting stuck somewhere and you really can't climb back out. Right. So when I lose sight of those healthy coping mechanisms, that's when I know, like, oh, I need to get back into that routine. Right. I stopped waking up early to go for a walk. I need to get back into those kind of things. Right.
So yeah, that's great. You answered that question about how do we know? How do I know? How can we know that if we need to escalate and do something more professional? And the other thing we talked about too is how sometimes depression and anxiety isn't just about feelings, right? Yeah. I mean, depression can often manifest in fatigue and lack of concentration. It does, nothing to do with feeling sad, but there's other kinds of things that go on with those mental illnesses. You say a word about some of those things?
I get headaches a lot when I'm super stressed. I don't know if anyone else gets those. Oh yeah, I get headaches a lot. I'll be like, oh, I don't know, I just can't breathe today. And I'm like, oh wait, that's actually anxiety, right? Or my stomach hurts. There's physical manifestations of our mental health as well. A lot of people get like backaches or chronic, pain in their shoulders and things like that. And often these are just physical manifestations of how they're feeling mentally. Mm-hmm. And it takes a lot of work to recognize that, and I think that's why it's so important sometimes to have these conversations and talk about how does it look for me versus you versus someone else. Right. And if we're open about it and we talk about it a little more, it becomes normative, right? For me to say, like, I'm having a really hard time right now, I'm not feeling my best. Right. I'm really depressed, or I'm feeling really anxious this week. And it makes other people more likely to recognize that in themselves. And sometimes it takes a professional to say, you know what you're really feeling is probably some anxiety. Or what you're really feeling is depression, actually. Mm-hmm. And it starts to click, and you start to recognize those things in yourself and are able to kind of use the skills that you learn from professional help to then say, oh, this is anxiety, and this is what I can do now. This is what they've taught me how to handle it. Or this is how my medication can help me handle that anxiety. So I just think it's really important that we have these conversations, and I love that Father Ron asked me to do this, because I think stigma is probably one of the hardest things about mental health and substance use, because no one wants to admit that, right? And even worse, sometimes we don't want to admit it about our families. We'll hear that, oh, my aunt is sick, but what kind of sickness is it, right?
Yeah.
A lot of people will fall to that. And I just think it's so important that we talk about it and we're really open, because having a heart disease is not any different in my mind than having chronic depression, because they're both illnesses. And honestly, they're both kind of invisible, right? But we have this way of, in our community, of putting people in a box with mental health diseases that is really detrimental to all of us.
Right.
Because if you're isolated already and you throw on top of that some stigma of like, oh, they're crazy, or they have this going on, that doesn't help.
No, not at all.
It's not going to want to make you talk about it, right?
That's right. That's right. No, and one of the things that those of us who've been around St. George for a while, we remember the Fullenwiders, and they were very strong advocates for mental health, and very involved in the local NAMI chapter, the National Alliance on Mental Illness, and big people about breaking the stigma. And because we know that if that stigma is there, it prevents people from getting help, and then when things get off the rails, they can go off the rails pretty bad, and it's not pleasant to witness. And having gone off the rails a couple of times myself, it's not fun to be off the rails. It's really not fun, and it takes a while to get back into that healthy space.
Yeah, it does.
It is, and so when I was reading the Surgeon General's piece, I saw something that was really shocking to me. 1 in 5 adults has some kind of struggle with mental illness, but when we talk about young adults, that number is 1 in 3, which is just shocking to me, that our young adults, our younger people, are struggling the way they are. You've got kids, and how are some ways that those of us who have little kids, we don't have little kids anymore, thank goodness, but those people who do have, don't worry, it doesn't change, they just get bigger, and smarter. How would a parent know, hey, there's something going on with my child, and I where do I even start looking for help, or how do I do that? How would people do that?
I think it's we talked a little bit about this the other day, and I think that 1 in 3 young adults, that's a huge number, right? And that's kind of scary, but I think in order to break that with our kids and the younger generation is recognizing it in ourselves. And perhaps that is actually playing into the number. Maybe it's that more young adults are actually getting diagnosed and are being seen, or they're getting help. But we got to break that cycle in our generation and figure out how do we teach our kids what is the way to handle this, right? If I'm always really anxious, my kids are going to feel that. So it's just learning, I think, for me, it's the initial learning how to handle that in yourself. And then beyond that, and recognizing it in your kids and having an open environment and having them being able to talk to you, right? I think that's huge. If your kids can't talk to you and tell them how you're feeling, and you don't really know what's happening because they're kind of closed off, it's usually a little bit of a sign that maybe there's something more going on there, and maybe it's the parenting dynamic, maybe it's not, maybe they're just having a hard time. But as parents, if we can be open to our kids, even when they tell us things we don't really want to know, I do that to my mom now, actually, even as a 36-year-old. I'm like, remember when I was younger, and she's like, I don't want to know, don't tell me. But having that open relationship is so important, even when they tell us things that we don't want to hear.
Right.
And knowing what's happening in their lives, not from the point of it's so easy now to stalk your kids if they have a cell phone. You can know where they are, you can see all their messages, you can see everything that's happening. But part of that is they also have to have the skills to be able to handle some of that on their own.
Mm-hmm.
And if you're constantly intervening, then they're not really learning how to deal with conflict and how to handle those situations.
Mm-hmm.
So it's kind of this fine line of like giving your kids the skills, but also know what's happening in their lives, I think.
Right.
That I think parents of our generation are kind of struggling with a little
Right.
bit. But I think it's really just breaking that cycle for ourselves. And we talked a little bit about the difference of like, people my age versus people that are older, and how mental health is something you just really didn't talk about.
Right.
And there's even jokes now. It's like, oh, this generation, they're wusses. They're babies. They don't know how to work hard, like that kind of mentality. And
Right.
I would argue it's that we've gotten to a place where we are okay recognizing these things in ourselves,
Right.
and it's not
Right.
that it didn't exist in that generation.
Correct. Right.
And
It was just hidden because of the stigma.
It was
right?
just hidden because of the stigma.
Yeah.
And the stigma, I don't know if anyone would be willing to volunteer, but I think the stigma probably is a little harder for an older generation right
Mm-hmm.
now. Not wanting to admit that, or thinking it's just a normal course of life to feel
Right.
a little down all the time.
Right. Well, and there's a almost a cultural message that we have to be able to fix ourselves and manage our things, and sometimes and while I can appreciate that, it can fall short, because there's some things that we just can't do
Right.
on our own. I mean, and really, when I think about this from a spiritual perspective, one of the things that we all say is that God, is all powerful and God can do for us, right? But then when we have a struggle, then we think, well, I need to fix this, rather than just saying, I'm going to give this to God and let God fix it, because I can't do that. And one of the ways that I think God can help us address some of these issues is God's given us therapists and psychiatrists and people who've developed medications that can fix the brain chemistry problems. Jerry Fullenwider used to say about people with mental illness is that we have a no-fault brain disease, a no-fault brain disease, and so it's I didn't cause it, nobody causes it, it just happens, and it's brain chemistry, it has nothing to do with anything else. But we have to get beyond that.
Yeah, absolutely.
That stigma and that cultural narrative about pulling ourselves up by our bootstraps.
Yes.
So I'm going to give you the last word,
Sure.
which is really hard for a preacher to do. Right?
We'll see if he actually sticks to it.
Yeah,
Let's
we'll
what
see.
happens.
So tell us, anything that I didn't ask about, or anything you think is important for folks to know.
I think it's a little bit of everything that we've talked about, but I would encourage, or actually challenge each of you to think, when you have a conversation with someone this week and you ask how they're doing and they ask you how you're doing in return, is to be honest if you feel like you can. Because the more we're honest in those conversations, the more that we're more likely to break that stigma and break that just hesitation to admit when we're struggling a little bit. I know I've struggled alone. Has anyone else ever struggled alone? Want to volunteer? Yeah, right? It's lonely, right? So if we can sort of get outside of ourselves and admit when we're struggling a little bit, I think we'll go a lot farther. And to ask people for help, I find sometimes it's easier to reach out and ask someone like me, if you don't even know me that well, and you just say, hey, what's the best way for me to find someone who is a psychiatrist who can deal with PTSD? It's sometimes easier to ask people that you don't even know that well, just for those resources and how to find it. And I'm one of those people, I'm not gonna ask your whole story. I don't need to know your whole story, but I can connect you with the people who can help you, right? And so knowing where to go can be really helpful. And just acknowledging that, if you find someone in your life is quieter than usual, or doesn't want to go out as much, or is drinking more than you are used to seeing them drink, or acting differently, that it's okay sometimes to reach out and say, are you okay? Is there anything I can do to help? Sometimes we don't want to know. I mean, I've done that. Sometimes I just don't want to know how badly someone's struggling, not because you just don't want to offend them. You don't want to scare them or something, right?
Right.
But just being able to put yourself out there. So I guess I challenge you to just be honest in how you're doing and how others are doing, and to put yourself out there to check on people. I think more than anything in our world right now, we need to check on each other. It's a really lonely world.
Yeah, amen. Thank you so much. Thank you. That's great. Thank you.